See, cervical cancer is very important for our country because India contributes to 25% to the kitty of cervical cancer globally. We get nearly 27 to 28% of the total cases of cervical cancer, and the same our number of deaths, our contribution is something like 28%. And to our surprise, every woman should know about it, that the highest number of deaths of a woman in this country are done by cervical cancer, much more than pregnancy. And that's why in majority of the people, 99% of the people do not know what the cervix is. जब हम उनसे कहते हैं कि बच्चेदानी का मुंह, उनको सब समझ आता है. Otherwise, cervix, they think about it in terms of, in the neck or something like this. So they are bothered about they do not know about their own body parts. But cervical cancer is one cancer which is 100% preventable in this country, and every woman should know about it, that this cancer should not occur in this country with them if it can be 100% preventable. Cervical cancer symptoms are late. When the symptoms occur, the disease is already late. The beauty about this particular cancer is that the cervical cells get shed, and these can be picked up with a very easy test, what we call a pap smear. With pap smear, abnormal cells, which are precancerous cells, can be picked up almost 10 to 15 years earlier, and this particular cancer can be treated right at that particular stage when the precancerous lesion has come, and so the 100% treatment is there. By the time patient gets bleeding, foul smelling discharge, contact bleeding, then it is very late, and invariably majority of the cases which are picked up in this country are in stage 3, and that is why the focus is on cervical cancer prevention, a cancer which is 100% preventable. The test which can be done for early diagnosis of cervical cancer, I think our aim should be to pick it up at a very early stage. And very simple test can be done by the gynecologist. Nurses can also do it, to do a pap smear, where you look at the cervix and see whether it's a healthy cervix or whether it has an abnormal discharge. A pap smear taken from the cervix and endocervical canal can definitely let us know whether we have precancerous lesion or not. There's a guidelines internationally available, which is uniform for all over the world, is that from age of 21 to age of 65, this cancer screening has to be done. In case if it is perfectly normal, then the gap can be taken as at 3 years. But if it is not normal, then it can be done, then the treatment can be taken effectively. So the earliest thing which you can do is the gynecologist has to look at it and do a pap smear. In case if there is a suspicious lesion, then we do colposcopy, which is an endoscopic procedure where the magnification is about 20 times, and we can take colposcopic directed biopsy to know where exactly the disease is, and the treatment can be readily given and it can be prevented. See, common causes of cervical cancer is that there is an HPV, that is human papilloma virus, which has been related with cervical cancer. The gentleman who found the correlation got the Nobel Prize, and the person who found the vaccination for HPV again got a Nobel Prize. So what we feel is that HPV, there are 200 viruses are there, young ones earlier than 30 years, especially the adolescents, 90% of them are infected with this. And out of these 200 viruses which can infect the young ones, nearly 15 are oncogenic. Rest are not said to be oncogenic. So the HPV has a good correlation as far as you find in cancer cervix, nearly 99% of patients have an HPV things. Then again, people who belong to socio-economic class, the people who maintain a bad hygiene, people who have an early sex, people who have sex with multiple partners are the various other factors which are correlated with cervical cancer. As far as the cervical cancer is concerned, the beautiful part is this is the only cancer in a man and a woman which is 100% preventable. For prevention, the base is the vaccination. This vaccination has to be given from the age of 9 years and it is recommended up to age of 60 years. Some people recommend it up to 45 years, but there is no controversy. This particular vaccination has to be given in reproductive life. If we give it between 9 to 14 years, only 2 doses of vaccination are required. That is at 0 time and at 6 months. And then after 14 years, instead of 2 vaccinations, 3 vaccinations doses have to be given. The two HPV vaccinations which are available in this particular country is Gardasil, which is produced by MSD, and another one is Cervarix, which is produced by the GSK. In 2018 it is expected that a nanovalent vaccine is going to come. The nanovalent vaccine will have a beauty that it will have HPV viruses 9, which is the most common viruses which are oncogenic, will be included. Gardasil has got 4 viruses, and while Cervarix has 2 viruses. Now it is recommended that each and every woman in this country should take vaccination. People have a doubt that the people who are sexually active should not take vaccination, but vaccination is equally good in them and to great efficacy. Now most of the time the people who come to us in our country do not come during adolescent time, because the government has no program of giving them a free vaccination, except the Delhi has started and Punjab has started giving it to a girl of 11 and 13 years, but I think it will take little time when the other people will do it. Cervical cancer screening should be done by all sexually active women, where the gynecologist examines you, sees the cervix visually. At the same time they do a pap smear screening done, and then now we have a test available which we call HPV high risk DNA testing, where after 30 years it is recommended that we should get this particular test also done for us to know that the 15 HPV viruses which are oncogenic, if they are there in your system, then the monitoring and the screening will be much more frequent for you to get treated early at a stage which is precancerous, for it to be 100% preventive. See, as far as the cervical cancer is concerned, or for any other reasons, same factors may be operating, but you find that a certain people who have a tendency for cancers probably will be more prone to cervical cancer. Otherwise, no great affinity has been shown or any high risk factor has not been identified. But we generally say that the people who have the families which are cancer prone, those family members should definitely get a screening done in such patients. Otherwise it has not been identified, except to say that if HPV high risk DNA panel is positive, if any other of those viruses are positive, this patient has to come for a frequent checkup to avoid development of cervical cancer. As far as cervical cancer is concerned, I think the main emphasis should be on a prevention. Anything which can be 100% can be prevented. Why should we talk about cure? Now, if the disease is early, that is cervical cancer stage 1, at that particular time there are 2 options available. One is surgery, another is radiotherapy. Both are equally effective and have got a good results. Now, as far as stage 2 is concerned, in this particular case, one has to decide about it, how much is the extension, and depending upon what is the facilities available in a given center, both surgery and the radiotherapy can be combined. Surgery can be given and are followed by a radiotherapy treatment. Now the chemotherapy has also chipped in such cases of stage 2 cervical cancer, where the chemotherapy can be given to make it operable, and then if patient can be operated, it is absolutely great. As far as 3 and 4 cancers are concerned, in such cases the choice is only radiotherapy and combination of chemotherapy. As I've said just now, that cervical cancer is one cancer which can be prevented to a large extent, and European countries have shown that this particular cancer can be totally eliminated. If it can be eliminated in the Western world, why it cannot be eliminated here? Survival rate of cervical cancer is, in a stage 1, it is almost nearing 90%. In a stage 2, it varies from 50 to 60%, and thereafter the survival rate goes down.